Good day, friends of Buzzy. Well, how was your Thanksgiving? Did you have a good time? Did you have too many people around? Today, we're going to talk about the answers to questions that I have been getting over the past 3 days. And the questions basically are, I feel crappy and I know somebody around me who got COVID. I've just tested positive and I feel fine. What should I do? I've tested positive for COVID and I feel crappy. When should I go into the emergency department? So I'm going to answer all of those questions for you. It'll be great. All right. So first of all, what do you do if you've tested positive and at least right now you don't feel that bad? First thing is that you want to start taking zinc. It's a little hard on the stomach, but the research right now is 25 milligrams 3 times a day. So at least I would take 25 milligrams with breakfast. If not, if you can take 75 milligrams, once 25 milligrams 3 times a day, do that. Second thing that's got good evidence for if you're actually positive for COVID, vitamin D. You want to make sure that your vitamin D level is up. Vitamin D is one that it's hard to overdose, so taking 200 milligrams, 500, 1,000 units, that's fine. So for sure, start by taking vitamin D and zinc. Now, there's good support for a couple other things. I would definitely start taking melatonin. Melatonin, not because you need to sleep, but melatonin is a mechanism for zinc to get into the cell to do its antiviral stuff, and melatonin by itself may be antiviral. So you want to take 10 milligrams of melatonin. Now, melatonin is not something that makes you get sleepy immediately. It actually resets your circadian rhythm, and it works about an hour to an hour and a half before the time you want to start falling asleep. So if you do take melatonin, 10 milligrams is a pretty hefty dose. There aren't good studies looking at different dosings, so you could certainly take with 3 or 6 milligrams if you're very sensitive to it, but you do want to try to schedule it at nighttime and take it not immediately when you fall asleep, because that may make you stay up a little bit longer the next night, ironically. Take it about an hour to hour and a half before you want to fall asleep. Other likely support is for 1 baby aspirin a day. I think you probably heard by now that strokes are a big issue. In fact, Ben Bova, who is a legend in the science fiction world, passed away today from strokes related to COVID. If you want to decrease the likelihood of strokes, 1 baby aspirin a day is likely something to help. Another thing that has good support is that people who are low on magnesium tend to be more likely to die. So since 54% of people are low on magnesium, go ahead and start taking 250 milligrams to 500 milligrams of magnesium once a day. Doesn't matter when you take it. Vitamin C has not been shown to be specifically helpful with COVID, but there's no reason not to take it. So I'm going to put that in the might help kind of category. So vitamin C, you pee it out, take as much as you want, get the chewables, they're tasty, I don't care. All right, so those are the things that are likely to help. Now, what do you do if you feel really bad, or if you're afraid you might feel really bad? And you're afraid, when do I go to the doctor? So first thing is, if you test positive for COVID, I would send someone else either out to CVS to get a pulse oximeter, or I would go online and buy a pulse oximeter at this URL. Now, what is a pulse oximeter? Pulse oximeter tells you what percentage of oxygen you have in your bloodstream. It's a good indicator of how well your lungs are filtering oxygen in. One of the problems that coronavirus does, or the SARS-CoV-2 virus does, is that it decreases the amount of surfactant that gives the oxygen an easy pathway into the lungs. And if you don't have an easy pathway into the lungs, even if you're breathing a lot, you may actually not be getting oxygen in. That's one of the weird things that we found about COVID, is that patients will come in not seeming to be that short of breath and have oxygens of 85 or 70. So when you get the pulse oximeter, it's going to be peace of mind to know that since you may not be able to tell if you're short of breath or getting the oxygen you need, you'll be able to test it. So what do you do with that number? First of all, test it on a fingernail with no nail polish when you get it, and then keep track. Keep a diary of what time of day it is, what your oxygen is. One of the things that's interesting about COVID is that people may have reasonable oxygen when they're just hanging out, but if they do any kind of exertion, it plummets. So one of the things we put into the emergency department guidelines for the CDC was that if there is exertional dyspnea, meaning if your oxygen, if you feel short of breath and your oxygen drops by 3 points with exertion. Exertion can be walking to the bathroom. In the emergency department, we use a 3-minute walking in place because we don't want people walking all around and spreading their COVID. So what I would do is test your oxygen normally, and then test your oxygen after you get up and walk around for 3 minutes or walk in place for 3 minutes. So that way you'll have a baseline of where you are. Now, when do you go to the doctor? If you have a drop by 3, or if you are 90 or below, I would definitely go to the emergency department. That's on the edge and you need somebody to look at you. All right, what are other things that you want to know if you get COVID, and when should you go to the doctor? Well, it's really important to know who is at high risk. So the people who are at high risk for COVID are obese, diabetes, kidney problems, immunosuppressed, particularly if you've taken any kind of glucocorticoids. So injections for rheumatoid arthritis, biologics, those are not an issue. But if you've been on steroids like Decadron or prednisone or prednisolone, that's when you're at higher risk, and you should have a lower threshold for going to the emergency department to get checked out. A new study out of Spain, which has the most human beings in it of any COVID outcome study to date, found that what is independently related to death is a glucose of 140 at the time of presentation. Lots of things can make your glucose go up, albuterol, having diabetes, being stressed, but 140 is on the side of diabetes, type 1 or type 2 that's not managed, and that is something that's definitely related to when you don't have as good an outcome. The actual outcome was death, and 44% of those who presented with a glucose of 140 died, as opposed to 13% who had a glucose under 140. So that's something that's a risk factor. Another thing to think about from a risk factor standpoint is that if you have anyone in your house who has those issues, then you need to sequester away from them for at least 5 days after your symptoms started. So as we've discussed before in the pathway life expectancy, what happens with COVID and what the progression is of the illness. So when you get exposed to the illness in through your nose, after that, it's such a slow growing virus that it takes about 4 days before most people start showing symptoms, before most people are contagious, and about 6 or 7 days until they show symptoms. So regardless of where you are in that window, and certainly it can be up to 14 days before people test positive, but the average is about day 3 or 4 after you get exposed, you're going to be contagious. And then day 4 or 5, you're going to start showing symptoms. And by 5 days after that, you're not shedding virus that can get somebody else sick. So after you start showing symptoms, until 5 days later, you definitely should not be around anybody who is sick or who is at high risk or anything else. So obesity, BMI over 30 or over, although it's not like it's a ledge. I mean, the whole thing, the risk level goes up. Anybody who's over 65, anybody with kidney problems, immunosuppressed, diabetes, those are the biggies. Certainly, African-American, Latino are at higher risk of bad outcomes as well. So just put that all together. All right, so the other things that are important to know, there are some things that I would do that don't necessarily have specific data supporting them, I would start taking quercetin, which is a bioflavonoid. It's another thing that helps get zinc into the cells for antiviral activity. I might, if I had any issues of chilblains, of the COVID toes, COVID, any signs of any bleeding things, I would certainly talk to my doctor about taking colchicine, which is something that seems to stop the specific pathway of clotting that's happening in COVID. I would definitely not take steroids. Oh my God, don't take steroids unless it's somebody who's a doctor in the hospital giving them to you because you have, because you're on oxygen or about to get intubated. It's kind of scary, isn't it? It's like it hits home when you're like, oh crap, we really have a positive here. What's going to go on? So we will be putting the meds in the chat, and there will be a specific link that's going to be on there. But are there, since I've got somebody asking questions, are there anything else that you would like to know? Any other issues, questions? So if you get the PCR test, if you get the swab in the nose, and it's done over a period of 6 to 24, 48 hours, highly sensitive and specific. So 95% chance you really do have it if you, or 95% chance you don't have it if it's negative, and almost 98% chance that you do have it if it tests positive. So I would believe the PCR tests. One other thing that we're actually testing now in Augusta, Georgia, is everybody who is 55 or older who tests positive is being offered nasal irrigation kits to see whether or not nasal irrigation decreases the likelihood of hospitalization. We're not going to know the results yet, but I can certainly tell you that based on what I'm seeing in this trial, and based on what we're seeing in terms of the severity of people who are doing nasal irrigation and still tested positive, if I were to test positive, or if I were around someone who tested positive, I would be doing nasal irrigation. We're talking a Neomed, Navage, about a cup up the nose, and I would put a half a teaspoon of betadine in with the normal saline solution that they give. So there are a couple different places that are looking at this, but I now know of 2 people who were directly exposed to someone who was symptomatic and tested positive for COVID. They did nasal irrigation twice a day. Neither of them got sick, so, or tested positive even. So I'm waiting on the results, but I certainly don't see anything that would make me not make sure I was doing nasal irrigation if I were exposed. It's scary times. We'll talk on a different episode about what are the durations for quarantining, how careful you need to be. I think the bottom line is, if you test positive, hole yourself up in a room, try to get as many open windows, even though it's cold, but everybody else in the house, try to keep the ventilation going, try to keep the air conditioning or heating blowing so that there's still circulation. Have them stay away from you, have them do nasal irrigation, and start taking a lot of these supplements and medicines that will boost your immune system and help you fight this off without having to go to the hospital. But if your oxygen's low, other thing is, or if you don't pee at least 3 times a day, those are the risk factors where I would definitely go to the emergency room. The light is at the end of the tunnel. We are close. You can read, you can watch one of our other videos about the time course of COVID, so you can kind of get an idea from Eastern Virginia Medical School about when you're contagious, when symptoms start, when the pulmonary stuff starts, when to expect that, so that you'll have a kind of idea of when you're out of the woods. So check out that video, and we will definitely post a list of all of these things. Stay safe, kids. Just try to keep away from people. 3 more months. We'll be vaccinated. We'll have herd immunity. 3 to 5, 6. We'll get there. 2021 is going to be our year. Totally. Stay alive. Be healthy. I'll see you before 2021, but I'm really looking forward to a new year. Bye, guys.